Hi, Dr. Darrow here. Very excited to speak to you about the healthy brain. So before we dive in, I want you to know anybody who watches this webinar is eligible for a free copy of my book, Stop Living in Isolation. In this book, we discuss everything you need to know from how to treat hearing loss, how to help prevent dementia, how to prevent and how to treat tinnitus, okay? So there's a number of topics and you can get this book for free. So right at the end, there'll be a link for you to click on to get a free copy of my Amazon.com best-selling book. So let's dive right in and talk about our goals for today. So there are three messages that I want to get across. The first one is, what is dementia? How do we define dementia? How is it, say, different from Alzheimer's, or is it the same thing? I also want to talk about some of the statistics involved with dementia and sort of the sad state of affairs when it comes to the research for dementia and Alzheimer's. Okay. Secondly, we're going to talk about hearing loss. So if you're wondering why hearing loss, well, what we've learned in the last decade is that untreated hearing loss can actually increase the risk of developing cognitive decline and dementia by as much as 200 to 500%. Yeah, you heard me correctly. Untreated hearing loss can increase the risk of cognitive decline and dementia by as much as 200 to 500%. Okay. Third, I want to talk about new treatments that are available for the medical treatment of hearing loss and how that impacts not only quality of life, but how it can increase cognitive function and how it can help to reduce your risk of developing cognitive decline. Okay, so let's jump right in. I want to start with this really powerful quote that I read in a book. It's called The End of Alzheimer's. Go ahead and read this. Everyone knows someone who is a cancer survivor, but no one knows an Alzheimer's survivor. It's a pretty scary reality when you think about the diagnosis of dementia or Alzheimer's is essentially a death sentence. Unfortunately, there are zero, not even one, FDA-approved treatment for Alzheimer's or dementia. Pretty scary. And you probably read in the newspaper about a year and a half ago that Pfizer, one of the world's largest pharmaceutical companies, overnight closed their dementia research center. Why? Because they had nothing in the pipeline. They had nothing to show for 20 years of research and probably billions of dollars invested, but they had nothing to show. That's how far away we are from the treatment of Alzheimer's and dementia. Okay, now while that may be sort of a negative spin, the positive spin is that we have learned in the last few years that there are many things that we can do to help prevent dementia. In fact, it has been shown that nearly 33% of cases of dementia are considered preventable. Okay, so dementia and cognitive decline. Let's start out by defining this, okay? So dementia is typically the umbrella term that you will hear that essentially encompasses a number of disorders like Alzheimer's, like vascular dementia, Lewy body dementia, frontotemporal, and there's several other kinds too. See, under this umbrella, we're talking about disorders that essentially all have that similar symptom of significant memory loss and cognitive decline, okay? So Alzheimer's is a form of dementia, okay? Let's talk for a second, okay? Because I want to make sure we're clear about what is not dementia and what is dementia, okay? See, this is one of those things where people get confused because as we get older, the truth is that we have a bit more difficulty with memory, okay? So, and there's a normal, right? There's a normal progression as we get older where memory does get a little bit harder. But let's go through a few scenarios, okay? I always ask my audience, have you lost or misplaced your car keys, right? If you're out there, you too can raise your hand because I can certainly raise my hand that I've misplaced my car keys all the time. Good news is that's not dementia, okay? Here's another one, all right? You know, maybe it be around the holiday season or back to school, right? You go to the mall. You probably know where I'm going with this. You go to the mall. You're doing a lot of shopping. You're running around. And then it's time to leave. And what do you ask yourself? Yeah, where did I park my car? Okay, good news, not dementia. See, it's okay to forget some of these things. And here's my personal favorite, and I, of course, have done it. I'm sure you have, right? Where you get up from the living room, you walk into your kitchen, and you open the refrigerator door and you ask yourself, what am I doing here again? Okay, see, these are all normal forms of forgetfulness. It's okay. So you can sort of wipe your brow and say, phew, I'm okay because I'm doing those things too. I do them all the time. What is dementia? Okay, let's go with the analogies, or let's go with the scenarios that I just laid out. If somebody hands you a set of car keys and you look at them and you wonder to yourself, what exactly do I do with these? That is worrisome, right? Not knowing what to do with car keys. Or here's another scenario. Let's say you're at that mall again, okay? You get to your car and you go to drive home. Problem is that you drive to the house that you grew up in, not to the house you've lived in for the last 5 to 10 years. Now that's troublesome. See, with dementia, there's a simple theory, right? The last to hire is the first to fire, which means the newer memories are the ones that go first. And so you'll remember the house you grew up in. You may even remember the name of your best friend in high school, but you may have difficulty remembering exactly where you live now, when you moved, what you ate yesterday, right? These are things to worry about. Now let's go to that scenario of going to the fridge and grabbing a bite to eat. You know, what's really sad is many patients with dementia towards the end, because you lose nearly all body functions, you lose the memory for things even like chewing and swallowing, okay? So people have difficulty when they have dementia with chewing and swallowing, and they can get sick. They can have aspiration, where they get fluid or liquid in their lungs, which can lead to disease, which can lead to pneumonia, bronchitis, which can eventually lead to death. All because you forgot that basic principle or that basic function of how to chew and swallow. So it's a very scary disease. And I'm pretty sure if you're watching this, there's a good chance that you have a loved one who's gone through this. My own grandmother died of dementia. It was very sad to watch her go through. She actually fit the statistic, which says people with dementia typically live 10 years beyond their physical body. It's pretty scary, right? To think that you can be on this planet, you can live physically 10 years beyond your brain, okay? I'd say my grandmother also fit the statistic, which is the average family spends about $57,000 a year to care for a loved one with dementia. So not only is it emotionally draining on the entire family, it's also a financial drain, right? It's a very significant consequence to try to live and care for somebody with dementia, which means it's all of our responsibilities to do everything we can to prevent dementia, which I will certainly get to later in the talk. Okay, so let's define dementia. All right, we're talking about a decline in mental ability that's severe enough to interfere with daily life. Okay, so it basically gets in the way. And if you think about the dementia diagnosis, okay, the way you get diagnosed is you have to have at least two, right? Two of the 5, and they're listed right up here, 2 of the 5 core mental functions that every one of us has. It's as if we're all born with these 5 core cognitive functions: memory, communication and language, ability to focus and pay attention, reasoning and judgment, and visual perception. Now, I want to go through quickly each one of these, but I want to put a specific focus on hearing, because I want to start to transition to how hearing loss and dementia are correlated, how they even end up in the same sentence or the same conversation. So if you look at memory, right? So right up here, memory is the first one on this list. And let me ask you the most obvious question, which is, if you can't hear me, could you possibly remember everything I say? Of course not. The obvious answer is no. So hearing loss gets in the way of the ability to store what you've heard, to store that memory of what you've heard. Okay. Second, communication and language. Now, you know, every relationship that you have, that you've had since birth, is based on the ability to communicate and language. So whether it be at work, whether it be at home, whether it be at church, communication is the basis of every relationship. And communication has both speaking and hearing. So when hearing loss gets in the way of communication, that too can put you at risk for developing dementia. Let's go to the third one, okay? One of the most common complaints that I get out of my patients is that they have difficulty in background noise, right? So there's a lot of issues when you go to a restaurant and there's some competing noise in the background and they say, I have difficulty paying attention. I have difficulty being part of the conversation. So right there, hearing, that core function of hearing gets in the way of the first three core cognitive functions: memory, communication and language, and the ability to focus and pay attention. There's also reasoning and judgment. Like I said, not driving to the right house. And then visual perception. I stop people all the time and I say, hey, you're wearing glasses. Are you wearing those glasses because you know it helps to reduce your risk of dementia? And they say, no, I had no idea. I just wear them so I can see better. Of course, right? When you have a sensory deficit like visual impairment, you must treat it. And little do most people know that if you do not treat your visual impairment, that can significantly increase the risk of developing cognitive decline and dementia. Now that should really make sense because you're depriving the brain of visual input. The same goes with hearing. You're depriving the brain of sensory input, right? Did you know hearing loss is the number one sensory disorder on the planet? That's how big of a deal it is. Okay, so hearing loss and its impact on cognition. I want to take you down a little memory lane. Go back it's been about 8 or 9 years now since we started to realize that hearing loss and dementia may be related to each other. Now, the first groundbreaking research that came out from Dr. Lin and his colleagues at Johns Hopkins, right? And you see it right up here. It's that top one. Hearing loss and cognition in the Baltimore Longitudinal Study of Aging. Now, in this study, they were looking at everything, right? They wanted to understand how human beings age and what is the aging process, right? What happens to our bodies? Well, they looked at everything. And perhaps the most stunning finding that landed on the front cover of every newspaper, it was on PBS, it was on the Today Show, it was everywhere, this highlight that hearing loss is correlated with cognitive decline and dementia. In fact, if I can summarize the data, you can look right here, okay? This is pretty powerful. I'm going to step out of the way. The risk of dementia with untreated hearing loss increases by as much as 200 to 500%, right? Look at that mild category. That's pretty impressive. That tells you, that's one of my sort of famous phrases, that a mild hearing loss is a major problem because even a mild hearing loss can increase the risk of developing cognitive decline and dementia by as much as 200%. Now, unfortunately, the sad fact is that when I see patients, most of them come in at the 300% mark, right? I have a talk with all of my patients that you waited a little too long. It's not too late, but you waited a little too long. And so now your risk, because you already have a moderate hearing loss, your risk of developing cognitive decline and dementia is as much as 300%, okay? So now let's start to talk a little bit more about hearing loss. So if we did a little quiz, what would you guess the number one cause of hearing loss is? Now, when I ask this question, I get a lot of answers, okay? I get noise exposure, loud noise, whether it be at work, whether it be at play, like at concerts. Yes, that is certainly a big one, but that, honestly, is really number two. I also get medications. Yes, there are a number of medications, especially those in the chemotherapy family used to treat patients with cancer, that can impact hearing and destroy some of those cells inside the ear. That's about number three. And then I have a lot of people say aging and genetics. And actually, they're both right because the number one cause of hearing loss is aging. The number one cause of age-related hearing loss is genetics. It's assumed that up to 75% of people have an age-related hearing loss gene. Now, there are a number of them, but that basically is 75%. That's 3 out of every 4 people are carrying a gene that makes them susceptible to age-related hearing loss. Now, you add in noise on top of that, maybe some medications, maybe some illness. Well, now you've really increased your risk. It's essentially, it's a matter of fact. It will happen to almost everybody. And if you think about the statistics, okay, about 10,000 people every day turn 65. Okay, we know that. That's been in the newspaper. We've heard that statistic a lot. What we don't hear a lot is that up to 50% of people, half the number of people between 60 and 70 years old, have hearing loss. Once you get over 70, so between 70 and 80, nearly 2/3 of people. And then once you get over 80, 80% or more of people will have hearing loss. So you see where their trend is going. It's one of those inevitable facts. It's a great thing that modern science has helped us to live longer. We have nearly doubled the life expectancy in the last 100 or 150 years. That's amazing. But what we've discovered is that as we age, certain things deteriorate, especially our sensory systems, like our eyes and our ears, which significantly increase the risk of the brain being dysfunctional, cognitive decline, and perhaps dementia. Okay, so I want to talk about sort of a typical hearing loss. Okay, so you see up here on this screen, right? What you see, and if you haven't had a hearing test, that's obviously step 1 is to get a hearing test. But I want to review this for you, okay? Now, red is right, blue is left. So we test both ears, obviously. We have a very thorough test. So all Excellence in Audiology certified providers do a thorough test where we establish the degree of hearing loss, and then we also want to understand how that hearing loss is impacting your brain, because that's what it's all about. Well, let's talk about the basic hearing test, where you raise your hand to hear a beep, okay? Red is right, blue is left. Now, 20 and above, okay? So I'm going to put my cursor here. 20 and above, this is considered normal hearing, all right? This person has a mild hearing loss. Now, there's mild, there's moderate severe, severe to profound, okay? This person is in the early stages of hearing loss. And what happens with this hearing loss, see, what I'm going to do is I'm going to gray out everything that this person can't hear. And clearly what you notice is that this person can hear the vowels, but they're having a lot of difficulty with the consonants. Now, symptomatically, what does that mean? That means the patient says, and I hear this every day, perhaps 5 times a day, I can hear, but I can't really understand. See, that's what's going on. You know somebody's speaking, but you can't follow the conversation because you're missing consonants. So you start to confuse things like he and she, C and T, fat and cat, okay? So you can see how you're depriving your brain of the clarity. That's actually how we explain it to most patients. It's not a problem of volume. For most people with hearing loss, it's a problem with clarity, right? Fortunately, new technology can pretty easily and near perfectly restore that clarity, okay? So, what exactly happens, all right? It's really an amazing thing with hearing loss. But first, let's talk about the normal ear-to-brain connections, okay? So on one side of the screen, you see the ear, okay? The ear, the cochlea, looks like a shell. And on the other side of the screen, you see the brain, okay? Let me just step out of the way. So you see, when you're looking at this, you see the ear, you see the brain, and you see these really bright arrows that connect the ear to brain. Those arrows essentially represent millions of neural connections from the ear to the brain. Now, let's look what happens with hearing loss. It's pretty stunning to see the difference, right? I'm going to show you that again. So here's the normal ear-to-brain connections. And here's what the ear-to-brain connections look like with age-related hearing loss. It's pretty stunning to realize, okay? Now, there are two things that are happening. Number one, there is a quantitative reduction in the number of nerves that connect the ear to brain. You catch that? There's actually a physical reduction. See, when the cells inside the ear die, the nerves that connect them from ear to brain, well, they die too. Those can't be retrieved. Number two, what you'll notice is that there is a qualitative reduction. A qualitative reduction in the nerves that remain. You see those three nerves up there? See, what's happening is they're weak. Now, guess what happens if you don't stimulate those nerves? You're probably all thinking that famous saying, use it or lose it. You're exactly right. If you do not use it, you will lose it. If you do not use those connections from ear to brain that remain, you will lose them. That is why hearing loss is classified as a progressive degenerative disorder. And so when you seek treatment from a medical specialist, what you're actually looking for is not just some amplifier that makes things louder. You're looking for specific neurotechnology that can provide auditory biological feedback to help stimulate all of those nerves, okay? Keep them going. You want to try to get out ahead of this progressive degenerative disorder so that you can slow it down, so that you can maintain the connections that you still have from ear to brain. Now I want to go through what are the consequences, okay? So I told you progressive degenerative disorder, but what does it mean for you or your loved one who's suffering with hearing loss? Let's go through that. There are three consequences of this neural degeneration. Number one, tinnitus, okay? Tinnitus is technically defined as a phantom sound in your ears or in your head, or perhaps in both, okay? Now let's talk about why tinnitus. How does that happen, right? So here's an interesting statistic. There are 50 million people that report having tinnitus. Guess how many people report having hearing loss? Yeah, you guessed it. 50 million people. There's a reason those two numbers are essentially identical, right? As the nerves break down from ear to brain, the brain goes looking for that input that it was used to, that it's lived with perhaps, the first 50, 60, 70 years of life, and now it's gone. And the brain goes searching for it, and in return, your brain hears a ringing or a buzzing or a swishing or a swooshing. I've heard nearly every adjective out there. So if you don't mind, I'm going to go back 2 slides, okay? So remember this slide, right? Remember this one where there's a quantitative reduction. So if you'll allow me, I want to take 1 second to talk about phantom limb pain. Many people have heard of that, right? So here's a case where perhaps somebody goes off to war or they're in a tragic accident and they lose a limb. Those patients will tell you that they can still feel the missing arm or the missing leg. And many times they will tell you that they feel intense pain in that missing leg or missing arm. It's called phantom limb, right? See, what happens is the brain is accustomed to the stimulation from the arm or the leg. Now, when you remove the arm or the leg, well, the brain goes looking for that input. And the arm is filled, as is the leg, with pain receptors. And so the brain tries to make up for that missing signal, and it senses pain. Now, thankfully, in the auditory system, there are no pain receptors. But you guessed it, there are sound receptors. So what that means is the brain is going to make up for the missing signal by inserting a sound, a ringing, a buzzing, or a swooshing. And so the goal of treatment, which by the way, we have an 80% effective treatment rate. There are new FDA-approved treatments for tinnitus that we are having tremendous success with across the Excellence in Audiology Certified Provider Network, okay? Nearly 80%. That means if you come in, we can essentially make the promise to you that there's an 8 in 10 chance that we can significantly reduce your tinnitus, right? We can't cure it. There is no cure, but there are very viable, very effective treatments by stimulating those remaining nerves. Again, I go back to the neurotechnology that provides that auditory biological feedback to the nerves that helps wake the brain up, that helps to stimulate the brain. Okay, so that's tinnitus. Number 2, let's talk about how this neural degeneration results in auditory deprivation. You realize at night you can close your eyes. Obviously, you go to sleep. You know what you can't close? You can't close your ears, okay? So from the minute you're born, your brain is accustomed to auditory input. So as we get older and we lose that auditory input because of hearing loss, because of the cells and the nerves breaking down, now the brain is being deprived. And there are large swaths of the brain that are stimulated by the ears. So symptomatically, what this means for you or your loved one is that there's going to be reduced clarity. Again, I'll go back to that symptom wherein you can hear that somebody's speaking, but you can't understand what they're saying, right? Hearing and understanding are two different things. What most patients will say is that they miss the beginning, maybe the end, maybe even the middle, right? Let's say there's a joke being said, and you heard everything right up until the end. Now you have a choice. You can either ask the person to repeat, or you can just laugh along with everybody else, okay? No. The third option is to treat your hearing loss and hear what everybody else is saying, even in a noisy background, okay? That brings me to can't hear in background noise. To hear in background noise, right? That amazing ability that we have when we're younger, where you can go to a crowded restaurant or you can sit around a holiday table, and there's lots of input, right? Lots of people speaking, maybe the radio's on, but you can filter the background and you can really focus in on what it is you want to hear. Well, with neural degeneration from the ear to brain, you can't do that anymore. You essentially need all hands on deck. You need 100% of the system working in order to hear in background noise, which is why it's really one of the earliest symptoms that my patients have, which is, I think I'm having difficulty. And I think the natural instinct of most patients is to blame it on the room. They blame it on the background. Perhaps they blame it on their grandson, who they insist mumbles, although nobody else tends to think that they mumble. Okay, number 3. Let's talk about how neural degeneration results in cognitive decline. And I'm really going to dive in deep on this topic, okay? What it typically starts out with, right, are these sort of innocent changes, these innocent deficits where there's difficulty in word finding, difficulty in name finding, right? So you know what it is you're looking at, but you can't seem to label it. You can't find the right word. And then there's those memory loss where, say, you have difficulty remembering some of the things that you have done over the last few days, right? Or you're not remembering that your spouse told you to be at a certain appointment or a certain time, or perhaps at work, a colleague told you about a meeting and you forgot, or maybe you misheard, okay? Let's dive in deeper as to how this neural degeneration may result in cognitive decline and dementia. Okay. There are this triad of theories of how hearing loss and dementia are connected to each other. Okay, so there's social isolation, there's cerebral atrophy, and there's brain overload. So allow me to go through all 3 of them, okay? Let's start with social isolation. Now, I want you to be able to read this quote. Blindness separates you from things. Deafness separates you from people. It's a very famous quote. It's a very telling quote, too, from Helen Keller. So if you don't know Helen Keller, she was both deaf and blind. And she was asked on numerous occasions if she had the option, which one of her senses would she retain, her vision or her hearing? And every time she said that she wished she had her hearing, and she would use this quote, that blindness may separate you from things, which seemingly aren't that important, but deafness separates you from others. Now, if you look back in the literature, right, because there's a lot of evidence for this, and this top article that I'm showing you, which is Hearing Impairment and Social Isolation in the Elderly, okay, this dates back to the early 80s, okay, and then the one right below it, let me just step out of the way, Association of Hearing Impairment and Lower Levels of Physical Activity. See, now what this is telling us is that hearing loss has the ability to socially isolate us. Hearing loss increases the risk of depression, anxiety, social isolation, and we now know that it can decrease physical activity. These are all terrible things for the brain and are all on the list of things that can increase the risk of developing dementia. Okay, let's go to number 2, which is cerebral atrophy. See, cerebral atrophy is defined as a significant loss of nerve cells in the brain. Okay, that makes sense? See, the brain that has dementia, what happens to it is that the nerves die. Okay, and so the brain ends up smaller, and so many brains that are found with dementia in post-mortem studies, they're about 30 to 40% of the regular size of a brain. Okay, they shrink down because we lose the nerves inside the brain. Does this happen with hearing loss? That's the obvious question. Well, there is certainly evidence for this. So a study came out fairly recently that showed the association of hearing impairment with brain volume changes in older adults. Okay? Now, they say a picture says 1,000 words, so I want to show you a picture. Because what they found in this research report is that there was this global, which means like the whole brain, was significantly reduced in volume in people who had hearing loss, right? And they had normal subjects, they had great controls. It was really an excellent study, and they showed specifically in people suffering with hearing loss that their brain volume was smaller than their age-matched peer, okay? Now, they say a picture can say 1,000 words, so I want to show you this, okay? So if you look on the screen, you see an image of a brain with normal hearing, okay? It's nice, it's plump, it fills out most of the skull. However, you also see a brain on the other side that has hearing loss. It's a pretty profound image, right? You see that it's smaller. What the studies have shown us, and there's been a number of reports on this, is that there's up to a 40% loss in brain volume, and specifically in some of the areas of memory, speech, language, and hearing, right? Because there's not just one little part of the brain that's involved in hearing. There's a global network that's involved in hearing and understanding and storing memory of what it is you've heard. Okay, third, let's go into cognitive overload, right? Many patients will tell me as they come in for their first appointment, at the end of the day, they're exhausted, right? They tell me they go to work and they have to listen 10 times harder than their normal hearing peers, right? When you have normal hearing, you don't have to put forth any effort. It just comes naturally. It's not something that you have to think about. But when you have hearing loss, you have to try to fill in the missing pieces. You have to work hard. People with hearing loss are excellent lip readers because they're trying to fill in the missing pieces. Oh, did they just say he or she, right? You're trying to fill in, and the next thing you know, you're a few seconds behind the conversation, and your brain just gets exhausted of doing this all day long. Is there evidence for this? Absolutely. There are a number of studies, and one of the more recent ones, see, this study talks about the effect of hearing loss and cognitive load on speech recognition with competing talkers, right? So essentially what they did in this study is they measured cognitive load, right? There's a way to actually measure how hard the brain is working, and sure enough, the brain works much harder in people with in people with hearing loss when they're in background noise, okay? So we've kind of known this and assumed it, but now there's actual evidence showing the brain is working much harder for people that have hearing loss when they're in that crowded restaurant, when they're sitting at home and there's lots of people talking and the dogs are barking and the radio's on. It gets very difficult and it taxes the brain. Cognitive overload can lead to an increased risk of developing dementia. So let me give you a little example, okay? I'm going to step out of the way. I want you to try to read this. See, it takes an extra second. And what you'll notice is I actually took out the consonants, which is what people with age-related hearing loss lose, right? So this sentence, "Dear Karen, how's everything? Will you meet me tomorrow at McDonald's? Love, Howard," right? You might have figured it out, but it took a little extra time. Now imagine that being part of a rapid conversation where somebody's talking to you and you miss 20, 30, 40% of what's being said to you. It's very common. When we test people with a mild to moderate hearing loss, they miss as much as 30 to 40% of what's being said to them. With treatment, we can get them to hear their very best, and we can put the clarity and the consonants back in and keep the brain stimulated. Which brings me to, I want to talk about the medical treatment of hearing loss. I want to talk to you about some of the advances. These are only in the last couple of years. Advances in treatment, advances in testing, advances in follow-up care in terms of treating hearing loss. And with our new patented neurotechnology process, we're able to ensure that patients truly experience the benefits of medically treating their hearing loss. So let's go through the 4 benefits that every patient is expected to experience when treating their hearing loss with a neurotechnology process. Okay, for starters, increased quality of life. Now this may seem obvious, and this is perhaps the number one reason why many patients come in, because their hearing loss is getting in the way of their life. Perhaps they came in voluntarily, perhaps they came nudged in by a family member or a spouse, but either way, the statistics are overwhelming, right? There's a report from the National Council on Aging that shows people who treat their hearing loss have significant improvements in overall quality of life, in relationships at home, and self-esteem. These are really important factors, okay, that when treating hearing loss, you can expect these benefits. See, treating your hearing loss doesn't only impact you. It affects everybody positively around you. Okay, let's go to number 2, which is increased cognitive function. Yeah, you heard that right. Treating hearing loss can kind of improve brain power. Now, where did I come up with this? So a study came out of the University of Texas, El Paso, okay? It's a fairly simple study where there were a group of subjects who had hearing loss and did nothing about it. Then there was another group of patients who had nearly the same hearing loss, and they began treatment, okay? What was found? Now, you have both groups, right? The only differentiating factor was that one group did nothing with their hearing loss, the other group did treatment. And in under 2 weeks, 14 days, they found significant increases in selective attention, memory recall, and processing speed. I mean, how impressive is that? Who wouldn't want improvements in their cognitive function in these 3 areas, right? That's how important it is to treat your hearing loss. And of course, the group who did nothing, they noticed no significant increases in any of these functions. So, gotta treat your hearing loss as early as possible. Let's go on to number 3. We want to try to provide the proper stimulation to reduce tinnitus. In addition to decreasing the experience of tinnitus, we want to try to clarify what it's like to hear in background noise, okay? So, I want to show you this study with the new neurotechnology, right? Now, this technology is designed to treat the cognitive aspects of hearing loss, okay? In a recent study, they found that new technology can actually help you hear better by 30% in background noise. Now, that's 30% better than traditional hearing aids, okay? That's a vast improvement, and improvements that we've never seen before. There's 20% reduced listening effort. So remember that cognitive load I told you about? Yeah, well, that goes down when treating hearing loss, and 20% improvement in memory recall. Of course you can remember better because you can hear everything that's being said to you. Now, I want to play for you a little example. I want to play for you what it's like to be in a noisy cafe where there's tons of background noise, right? And there's a conversation happening. This person has a mild hearing loss who's listening, and I want you to listen to what it sounds like.
Really glad we came to this restaurant. It's always been one of my favorites. The desserts are amazing.
That was pretty difficult, right? trying to focus. There's all that background noise. Now I want to go ahead and I'm going to play the exact same scenario, except this time I want to show you what the stimulation with neurotechnology sounds like.
I'm really glad we came to this restaurant. It's always been one of my favorites. The desserts are amazing.
That's pretty impressive stuff, right? Where basically you can now filter out that background noise. Okay, let's go on to number 4, which is that the medical treatment of hearing loss may significantly reduce the risk of cognitive decline and dementia. Yeah, you're right. I said that, okay? There are a multitude of studies. I feel like they're coming out weekly, if not daily, showing that the early treatment of hearing loss is really important at maintaining cognitive function and reducing the risk of cognitive decline and dementia, okay? So I want to show you a report. So the European Dementia Commission, the world's largest dementia report, they were scientists from across the globe, researchers from across the globe, who basically wanted to understand everything, the current state of dementia. And the two most important findings, right, and this is really critical here. The two most important findings is that 1 in 3, so 35% of people with dementia were considered preventable. That means moving forward, we have to do everything we can to highlight the importance of prevention. Because 35 out of every 100 cases of dementia may be prevented. Perhaps your family member, perhaps my grandmother. If I knew then what I know now, perhaps I could have helped my grandmother and we could have helped her to avoid that dreadful diagnosis of dementia. Okay. Secondly, really one of the most important things that came out of this report was they listed everything you can do to help reduce the risk of dementia, right? Now, on this list, there were a number of really important things, and some of them are obvious, right? Like we need to stop smoking. We need to reduce diabetes. We need to reduce our weight. We need to reduce our hypertension. We need to increase social activity, education, and physical activity. But at the top, right there towards the top, one of the most powerful things that you can do, one of the most important modifiable lifestyle factors for the prevention of dementia is the early treatment of hearing loss, right? I want that to really sink in. The early treatment of hearing loss is perhaps one of the most important things that you can do. One of the easiest things that you can change in your life to help reduce your future risk of developing cognitive decline and dementia. It's a really powerful report. Okay, so what do you do about it today? Okay, there are two things two take-home assignments that I need you to work on. The first one is to schedule an appointment with a hearing care specialist. You can go to excellenceinaudiology.org and you can look up a local provider that is certified by our network, by our program, that will provide the highest level of care and make sure that treatment is affordable for you, right? You must be evaluated and you must develop a treatment plan. Treating hearing loss is not a retail transaction. It is the medical treatment of a progressive degenerative disorder, okay? Number 2, right? Ask any clinician what they would wish every patient would know. That's what I tried to put in the book, okay? So the book that you can get for free, Stop Living in Isolation, you can get this book, and I want you to read it. I want you to be educated, right? This is an unbiased scientific report. There's at least 15 pages of reference sections, so you can go back to the original articles and read more about treating hearing loss if you'd like. But this book essentially summarizes everything you need to know about the medical treatment of hearing loss and tinnitus. Everything from why the common person avoids going in to get their hearing test to how to pay for it, right? Because there is a cost associated with it, but we have figured out the best way to make treatment affordable. See, our treatment program is simple, low monthly payments, okay? That includes everything you need, full lifetime warranty, pair of neurotechnology hearing aids. All your supplies are included, And the thing about hearing loss, because it's a progressive degenerative disorder, as your hearing and cognitive needs change over time, we will also adapt the treatment program and change your technology accordingly, and you never have to worry about a thing. Okay, so my final take-home message, I appreciate you sticking with me to learn all this valuable information. Aging is inevitable, but decline is optional. So which do you choose? Thank you so much for being here with me. Take care of you, take care of your loved ones, and keep striving towards excellence in audiology. Take care, everyone.